Hello, everyone, and thank you for joining us today for a gut-brain axis dysfunction among college students, a call on professors and other academic professionals to be informed webinar. Our presenter today is Jared Brown of Concordia University, St. Paul, Minnesota. My name is Sidra, and I'll be your moderator today for Hawks Learning. We will have a live Q&A session after the presentation, so please enter any questions you have into the Q&A module as we go, and we'll be sure to answer them. I'll now hand it over to our presenter.
Citra, can you see my slides okay, and are they moving?
I can see your slides, and yes, they are moving.
Great. Well, good afternoon, good day, everyone. I hope all of you are doing well. We're going to jump right in because we got a lot to cover. So my name's Jared Brown. I'll be the presenter for today's webinar presentation. If you have any questions, again, type them in the chat box. If you think of any questions after the fact, you want to have a discussion about any of these topics, reach out to me. This is my email address. This is a topic I would assume that most college professors probably haven't maybe considered within this context of one of the many variables that can adversely impact student academic performance, health, and well-being. If you have not heard me present for Hawks Learning before, this is a copy of my brief professional biography. I'm a professor, trainer, researcher, and consultant. I have a variety of different degrees and a number of different topics. I'm currently working on another degree right now in applied clinical nutrition. I do a lot of work in the area of integrated behavioral health and digestive health, the gut brain health axis are areas that I have been focusing on for a good handful of years now. And the reason why I do that is the evidence is pretty clear that if you ever work with someone that has a severe mental health problem, drug and alcohol issue, people with neurodevelopmental disorders, if you ever work with individuals that are dealing with chronic life stressors, they don't eat well, they live a sedentary lifestyle, pretty good chance that person's digestive health functioning is not working at optimal levels. And when digestive health is not working at optimal levels, that should be an indication that the brain is not working at its best capacity, basically the gut brain health axis. We'll take a deep dive into all of that today. These are a few of my credentials and certifications. I wanted to alert you to the fact that I do have two separate certifications related to what we're talking about today. I am a certified digestive health specialist, and I have a certification as a gut health specialist. If you hear me talk about nutrition today, I am a certified functional nutrition counselor. I'm not giving any medical advice here. So please don't take this and try to give medical advice to students or tell them what to eat. Make sure they're working with a qualified healthcare provider when doing that. And when I do consultation work, and I've consulted on cases, homicide cases, I've consulted on domestic violence cases, fire setting, lots of cases related to mental health, and much less severe kinds of situations as well. These are my main areas of focus. These are the areas that I have found to be most helpful when understanding complex human behavior. If you have any questions about any of these topics, let me know. A couple of these topics I have done for Hawks Learning. I did a training for Hawks Learning previously on food insecurity, and today we're covering the gut brain health axis. And I believe all of you have a copy of today's training description. So as we dig deep into this topic, let's just take a look at this statistic. Why do we want to care about this? Digestive health issues impact the majority of people in the United States. When we start talking about student populations, there's a strong argument that this number could be even higher. And I'll talk about why that's the case. Again, why should you care about digestive health, the gut? Because the research points to the fact that when digestive health functioning is working at optimal levels, That plays a role in increasing energy. So if you know people with chronic fatigue, plenty of research says chronic fatigue may be partially related to digestive health problems in some cases. Again, it goes way deeper than that. A healthy gut has been linked with reductions in depression and anxiety. So, if any of you are in the mental health arena, optimizing gut health is a frontline intervention to helping people improve their mental health. If you want to sleep better, optimize the gut. If you want to reduce stress, optimize the gut. There's literally thousands and thousands of studies on the gut brain health axis. So basically, a healthy gut equals a much more healthy brain and a healthy body. So digestive health disorders, some of these slides could be full day trainings in and of themselves. So take that into account when we go through this training today. Again, we have an hour. We're going to be scratching the surface with some of the topics and going a lot deeper with other ones. There are all kinds of different digestive health disorders out there, or different kinds of digestive health complaints. I'll talk about irritable bowel syndrome today a little bit. I'll talk a little bit about inflammatory bowel disease. We'll talk about constipation. These are topics that I don't think a lot of people talk about within the school context. But surprisingly, there have been studies on these topics as it relates to college students. So this is a big topic to consider when interacting with college students. If you want to take your knowledge to a deeper level, when you're studying the gut brain health axis, digestive health disorders, you want to be aware of this: disorders of gut brain interaction. This is kind of the most up to date term that you'd want to be aware of. Previously, this was referred to as functional gastrointestinal disorders. These kind of disorders are highly prevalent. They can be very difficult to manage for a variety of reasons. They can contribute to emotional problems, behavioral problems, sleep issues, all kinds of things. There are numerous studies that have been published on these kinds of disorders. I would also alert you to the fact that the Rome Foundation would be something you would want to add to your list of resources and readings. If you Google the Rome Foundation, it's an organization that's dedicated to the study and better understanding of these topics. And on that website, they have all kinds of resources and trainings. These are some of the common gastrointestinal disorders that are out there. Again, by no means is this an all-encompassing list. Celiac disease, GERD, irritable bowel syndrome. It's beyond the scope of today's training to get into the weeds on the specifics of each of these disorders. But when you think of these disorders, again, disorders in gut-brain health interaction, a lot of times these disorders are amplified by stress, unhealthy lifestyle choices. Again, there's all kinds of variables to take into account with these kinds of disorders. If we look at some of the literature when we're talking about different kinds of gastrointestinal disorders, stress levels are talked about frequently, what the person eats, antibiotics, we'll talk about that in a few minutes, cigarette smoking, all kinds of variables to consider. When we get into the weeds in terms of the gut brain health axis, you want to be aware that this is a bi-directional communication network that goes on between the gut and the brain. There's a lot of components that are part of the gut brain health axis. So if any of you are like neuroscience professors, I'm sure you've studied the HPA axis. You're probably aware of the enterotic nervous system. People are surprised to learn that the gut has its own nervous system. I think people are also surprised to learn that a very high percentage of dopamine and serotonin are produced in the gut. How does that relate to what we're talking about today? If serotonin and dopamine levels are not at optimal levels, that's been linked to more mood disturbances, more behavioral problems. It is a huge factor to take into account. So, the gut brain health axis, bidirectional communication between the gut and the brain, this axis involves the central nervous system, the autonomic nervous system, the enteric nervous system, the HPA axis, which is the hypothalamus, pituitary adrenal axis. Why should you care about this? Because this is a hormone regulator. This is our body's main stress response system. The end product of the HPA axis is cortisol. It's a big topic to be aware of. If you want some more handouts, resources on the HPA axis, shoot me an email. I have some good stuff I can share with you. Hopefully, this slide kind of sums up why we're here today. If you know people with any of these disorders, if you are working with college students who are dealing with depression, anxiety, sleep issues, if it's a colleague of yours, if you're dealing with any of these disorders yourself personally, plenty of research shows that the gut brain health axis is not working at optimal levels. If the gut is off, that has an influence on our immune system. The gut is the hub of immunity. It is responsible for so many functioning capabilities in the human body. People with a lot of allergies, you will find multiple studies that talk about that could be an indication that the gut is off. If somebody, again, is dealing with mental health disorders, if you're a school counselor, psychologist, social worker listening to this, a frontline intervention is to help that student optimize the gut. We'll talk about some practical tips, strategies, and solutions to be aware of. There are a multitude of factors that can adversely impact the gut. It's all over the map. There's prenatal factors, there's early childhood factors, family factors, stress factors, the list goes on. Take a look at this slide. You see the first thing here. If somebody went through life and were on a lot of antibiotics, plenty of research shows the overuse of antibiotics throughout one's life can have a very negative impact on the gut brain health axis. Chronic inflammation, we're going to talk about that in just a little bit, but why do you want to care about that? Because chronic low-grade inflammation is a driver for most diseases and illnesses, including depression. If somebody's dealing with a ton of stress, and this is a reason why we want to be aware of this with students, going to college can be very stressful. Now, I'm not saying it's always a bad stress, it could be good stress. But academic stress, juggling work life, social life, family life, getting homework done on time, psychological stress can adversely impact the gut. If you've been part of some of my other trainings I've done for Hawks Learning, I've done quite a few on nutrition related topics. We know from the research literature that a very high percentage of college students do not eat healthy. The overconsumption of sugar, caffeine, fast food, ultra processed foods can wreak havoc on the gut. If you are a smoker or you're exposed to secondhand smoke, that's an environmental factor that impacts the gut. Pollution exposure, you're finding more and more studies on this. Let's say the student lives very close to a busy freeway or right across the street from a factory and they're breathing in lots of air pollution. That may be a factor to take into account as well. I want to introduce all of you to this term as well, dysbiosis. When studying the gut brain health axis, you have to understand dysbiosis. Basically, what this is an indication that the good bacteria and the bad bacteria are off in the gut. So the bad bacteria is typically taking over, the good bacteria is not in balance. When we have gut dysbiosis, so our gut balance, the bacteria, all of the things going on in the gut are not in homeostasis and they're not in balance, what can happen? This has been related to more inflammatory issues, so chronic low-grade inflammation. This could be a factor with weight gain. I'm not giving medical advice here, but if people really struggle with losing weight, working with a qualified healthcare professional, obviously important, but gut dysbiosis could be a variable to take into account. If someone has a hard time losing weight, has anyone helped them optimize gut health performance? This can be related to more problems with blood sugar dysregulation. Plenty of studies talk about this within the context of type 2 diabetes. The list goes on and on here. If you have questions, again, type them in the chat box. So again, like gut brain health access dysfunction, all kinds of risk factors. The very nature of being overweight should alert the person that this could be a factor for gut dysbiosis. If somebody is consuming a very high degree of fat and sugar in their diets, another variable to take into account. Social stressors. What happens if the student or whoever it is dealing with a lot of social stressors, conflict, a recent breakup? Maybe they live in a very crowded household. There's actually a couple studies, not specific to college students, but to the general population, that if you live in a very chaotic and crowded household, obviously that builds up stress. That could be related to more digestive health related issues. If the person is dealing with gut dysbiosis, what else could be at play here? What could be some of the consequences you want to take into account? Mood instability, up and down mood swings, depression, anxiety, worry, increases in fear, increases in stress reactivity. So somebody has a really hard time managing stress and they just can't cope with that stress and their mood is all over the map. Gut dysbiosis has also been linked with having more food craving issues. It can impact our metabolism and it can compromise our immune health, just to name a few. If you are a person running any program about well-being, focusing on like a burnout prevention program, whatever work you do and you want to enhance well-being, particularly emotional well-being, optimize the gut because that again is where a lot of our hormones are produced and it's the hub of immunity. So if the gut is off, that's been linked with lower levels of emotional well-being as well as psychological, behavioral, and physical well-being. So any kind of well-being work you do, understand the role and impact that the gut can play. Here's one study that talked about this specifically within the context of college students. There's not been a ton of studies specifically on college students, but there have been some. Why do I believe that this is a real issue among college students? Because we do have some studies that show that the gut and the microbiota profiles are different in college students. Think of the stress that college students go through. So high levels of stress equal more digestive health issues. Think about sleep patterns. When someone goes to college, a lot of times they're not getting optimal sleep. They could be up all night, working a job, doing homework, going out and partying. Being up all night long has been linked with more gut health issues. Living again in a very crowded kind of household could add stress. Think about the diets of many college students. If students are eating campus food, and I'm not pinpointing any college campus in particular, but if you look at the general national research, food that is served on college campuses oftentimes is not that healthy. It's loaded with sugars a lot of times and sodium and fats and things of that nature. And Excessive screen time exposure. People who are on the screen for long periods of time, particularly in the evening hours when the human body is meant to rest and not be looking at screens. Excessive screen time exposure has also been linked with more gut health issues. Another term that you'd want to be aware of if you want to take your knowledge to a deeper level is leaky gut. When you hear that term, that should alert you that we have more gut dysbiosis going on. The gut is not working at optimal levels. When somebody has leaky gut symptoms, it could contribute to all kinds of things. The symptoms could be all over the map: gas, bloating, cramps, more aches and pains, food insensitivities, chronic diarrhea, chronic constipation. If somebody is dealing with leaky gut for a long period of time, that has been linked with more headaches, more daytime fatigue. It can impact our ability to concentrate. We might be more confused. It's been linked with more skin problems, joint pain, the list goes on. So again, if somebody is dealing with a gut that is not working at optimal levels, that can impact all facets of health. Mental health providers, again, if you are a college program offering degrees in counseling, psychology, social work, human service, you would do quite well, and it's supported in the research literature, to start infusing lectures, start infusing these topics into your curriculum. It will only help you better understand complex human behavior. When we study this within the context of mental health disorders, a lot of variables to take into account. So again, we talked about the enterotic nervous system. Our gut has its own nervous system. The nervous system in the gut communicates with the nervous system in our brain. And part of that is through the HPA axis. And if we break this down even more, there's all kinds of different endocrine responses, basically hormones, neurotransmitters going on in the body. When this system works properly, our body's in balance, our moods more stable. When this system is out of balance, we're at greater risk to suffer or deal with more mental health related challenges. Going a little bit deeper into this, as we spoke about psychological stress before, any kind of stress, again, it could be good stress, it could be bad, could adversely impact the gut. Typically, bad stress, chronic stress, toxic stress, cumulative stress is going to be more harmful, especially if that stress goes on for a long period of time. And now, if you couple that stress with high levels of anxiety, high levels of depression, lots of sleep issues, poor dietary practices, it's just the perfect storm for profound digestive health issues. And the more digestive health issues we have going on, the more that can impact our psychological well being and health. Pointing this out, if you were part of the other training I did for Hawks Learning, we did talk about the Western diet, fast food consumption, ultra processed food. The way, unfortunately, most Americans eat, according to the research, they eat foods that fall under the Western diet. And to be brutally honest, if you eat this way, it's a threat to your health. The Western diet would be fast food, foods that are loaded with ingredients you can't even pronounce. If you consistently get food from gas stations, drive-throughs, sit-down restaurants where you're getting tons and tons of fried foods and loaded with cheese and ketchup and mayo and things of that nature, they may all taste very good, but they're not good for the human body. The Western diet way of eating has been linked with profound digestive health issues, including all kinds of other issues. This is just one statistic of many that I'm not saying if someone eats this way here and there, it's probably not going to do a ton of it, give a ton of issues to the human body. But It's somebody that eats this way day in and day out, over and over again. And maybe it's a college student who's eating fast food every single day. That is going to wreak havoc on the body on some level. Another variable to consider is irritable bowel syndrome. Plenty of research supports the fact that irritable bowel syndrome, very common, but there are some studies that point to the fact that this is a topic you absolutely need to be aware of among college students. When we think of irritable bowel syndrome, think of those disorders of gut brain interaction we spoke about before. So, some of those functional gastrointestinal disorders. If somebody has irritable bowel syndrome, that is dysfunction in their gut brain health axis. It affects the stomach and intestines. People with this syndrome have changes in bowel movements. Oftentimes, they have feelings of incomplete bowel movements, excessive gas, abdominal pain, abdominal cramps. There's different subtypes of irritable bowel syndrome. I won't have time to get in the weeds with all the subtypes, but if somebody has irritable bowel syndrome, it's not been treated, it's not been addressed, it's not managed, it has been linked with more migraine headaches, sleep issues, depression, anxiety, and even fibromyalgia in some cases. And the research again points to the fact maybe offering classes on this, offering trainings, because it is an issue that is talked about in the empirical based research literature. How does this relate to college students? Irritable bowel syndrome, or any kind of symptom associated with digestive health disorders, if gone untreated among college students, could contribute to more academic performance issues. The reasons, again, why people may have irritable bowel syndrome are really many and varied. Could be genetic factors. There's a ton of research that talks about early life stress could be a factor. Family histories, looking at all of the different variables when someone grows up. If somebody is dealing with irritable bowel syndrome and they haven't received proper treatment, services, supports, education, or awareness around this syndrome, some studies point to the fact that unfortunately, in some cases, the individual may not have good coping skills. If you deal with irritable bowel syndrome, it could amplify stress. It could amplify sleep issues. If we're chronically sleep deprived, we might have more negative emotionality. So it could drive the bus with higher levels of depression and anxiety. We may have greater difficulties accomplishing our task. And if we're talking about this specifically within the context of college students, it could trickle down into impacting academic performance. There's more studies than you realize on this topic as well, but constipation is an issue among college students. I'm not saying every college student has constipation, but it is a topic that is talked about in this literature. When we talk about constipation symptoms, this is when someone has fewer than 3 bowel movements per week. This can contribute to sluggish feelings, abdominal pain, bloating, uncomfortableness. The causes for constipation are all over the map. We could spend a full day just on this training. Medications, certain medications can contribute to constipation. Living a sedentary lifestyle. So maybe it's a student that never moves. They're just on their screen constantly. They're not exercising. Low grade dehydration. So someone's not getting enough fluids. Maybe someone doesn't have a lot of fiber in their diet. Maybe they have full blown irritable bowel syndrome. Maybe they're abusing laxatives. The overuse of laxatives has been linked with more constipation. And you'll see on this slide the functional constipation, just another term you want to be aware of. But constipation, another digestive health issue, chronic constipation can impact mood, behavior, energy levels, sleep, and the list goes on. If it is a student or anyone that's dealt with any kind of victimization, face to face, or online. Peer victimization has been linked with more digestive health issues. So if that student, when in high school or in college, was experiencing a lot of teasing, bullying, humiliation, the very nature of experiencing that kind of trauma or stress has been linked with more gut health issues. So another variable to take into account if you're a college program, education around ways to reduce or eliminate bullying, teasing within the entire college campus. By default, you're actually targeting digestive health as well. Academic stress oftentimes can contribute to more gut health issues. So take this into account, especially during times of the term where maybe there's more workloads, maybe finals where people are cramming and staying up all night long. Maybe they're drinking a lot of energy drinks, lots of caffeine, sugar sweetened beverages. Academic stress can adversely impact the gut. So, very, very important to take this variable into account as well. Other things to consider just to kind of visually show you here. So, if we want to optimize educational outcomes, this is for kids, teenagers, adults, it doesn't matter the age. These are some of the variables to take into account in the literature. Now, you as a college professor, I'm not saying going and asking every student about their breakfast patterns, but maybe that college could offer a training or a class about some of these topics. A frontline intervention is to just teach people about these very topics because a lot of times we've never had training on this. Students or faculty have never even considered these kinds of connections. We're going to talk about breakfast consumption in a few minutes, but if you want to improve academic performance, eat healthy breakfasts. Lower the intake of energy dense foods, which is basically lots of fast food, highly processed food. If someone is eating lots of foods with empty calories, lots of sugar, that can impact academic performance. And then over the long haul, too, helping people learn about the importance of eating healthy foods is a very good way to help support positive educational outcomes that maybe college campuses don't routinely consider in this equation. I'm going to park the brakes there and let this digest for a second, open it up to thoughts, questions, concerns, anything you want me to go a little bit deeper into. And then this next section, we'll get into some red flag indicators, just different things you'd want to consider if you want to take your knowledge to a deeper level. Give it about 5 more seconds. If anyone has questions, just type it in the chat box and I'm more than happy to clarify anything.
We do have a question. How do you restore gut health? What types of foods or supplements can you take to achieve that?
The last section of today is all about that very topic. So I'm not going to answer that this exact second, but when we get to that section, if I did not answer your question in detail, let me know and I'll try to go a little bit deeper into the weeds with that.
Sure. Another question we have is, can you say a little bit about the gut ASD connection?
Yeah, with autism, yeah, autism is one of my main areas of expertise. And shoot me an email. I have some podcasts I've done on that very topic. But the research to date, and there's been a ton of studies that look at autism and gut health issues. There's a The research says about 90% of people on the autism spectrum have digestive health issues, gut brain health abnormalities. Why do we want to care about that? Because the research says if a person has autism and their gut is not at optimal levels, it just amplifies some of the classic core symptoms of autism. It can amplify sensory issues. It can amplify executive function impairments. It makes social skill impairments even more intense. So there's a strong empirical based argument. If you want to help people on the autism spectrum enhance functioning, do all the good work you're already doing, but also target the gut, sleep, getting inflammation down, and enhance healthy eating patterns. Let me know if you want me to go deeper in the weeds. I could talk all day about autism and nutrition in the gut. It's a fascinating, complex topic. And shoot me an email too. I have a lot of resources on that. I'm more than happy to share with you.
Thank you.
Mhm.
We have two questions left for now. How has the COVID pandemic impacted the gut-brain health axis?
I hope I added a slide on that. And I give a lot of talks on this, but there are some studies that showed that during the heart of COVID, during the lockdowns, particularly, the stress related to COVID only amplified everything I'm talking about. So during the heart of COVID, during the lockdowns, stress eating went up, more screen time exposure, more loneliness, more fear, more worry. So any kind of massive trauma, any kind of event, it could be a big event, a small event that causes trauma, worry, fear, unrest, just makes gut health worse. So basically, COVID made this a lot worse. It's probably the easiest thing I can say. Now, how is it affecting it now? It's difficult to say. COVID is still with us, but by all accounts, it's no near the level it used to be, but it is a variable to consider.
Thank you. And then one last question for now, and then we'll ask the other ones at the end. Will you be talking about drug use, especially marijuana, in connection to this subject?
Not not directly. There's a number of studies that look at the use of drugs, and I would take it a step further, looking at any kind of behavioral addiction, not just drugs, not just alcohol, but excessive screen time exposure, caffeine, tobacco, sugar. There have been studies on all of those topics. If you are working in drug and alcohol treatment programs, if you are running a college program that's teaching students about drug use, alcohol use, there's lots of empirical based studies that talk about clients with those backgrounds oftentimes have gut health issues, and chronic alcohol use has been linked to this. I think I might have a slide on alcohol use I'll cover in a little bit, but ask that question again at the end if you want me to go deeper in the weeds.
Thank you.
Thanks, guys, for the questions. Keep them coming. I'll stick around afterwards and stay as long as we need. I'm not asking anyone to go diagnose these things or screen for it, but just if we want to start moving in the direction of understanding this, and again, if any college program, any campus, I think you do quite well offering a class or certificate, a micro credential, or even a mini degree program in some of these topics because it can really relate to any field of study. But if you really want to get in the weeds with this, take a look at this slide. These would be just red flag indicators to be on the lookout for that might indicate someone is dealing with some digestive health related issues. I'm going to talk about rumination in a couple minutes, but if someone has lots of rumination, problematic thinking over and over and over again, that's a pretty good chance their gut is not working as well. Take a look at this too. This is why we want to be aware of this because sometimes gut health issues are a real hidden problem. So just pretend it's a college student that's dealing with some digestive health issues. They might have a lot of shame. They might have a lot of fear. They might hide this. It could contribute to more fear, worry, anxiety. Maybe the student has a hard time sitting in class and they have to get up constantly and go to the bathroom. Maybe because of the student's digestive health issues, they're dealing with a lot of body pain where they're fidgeting a lot and having a really hard time sitting still. If you look at this through a trauma lens, chronic digestive health issues could constitute a medical kind of trauma. So it's another variable to consider here. Signs of an unhealthy gut are all over the map. These are some of the red flag indicators you'd want to be aware of. By no means am I saying if somebody has a high degree of fatigue or a lot of skin problems, that equals gut health issues 100% of the time, but there's a pretty good chance in most of the cases, their gut is not working at optimal levels. If you know people with autoimmune disorders, there are all kinds of autoimmune issues out there. That is a sign of an unhealthy gut, amongst other things. So, if you want to tackle autoimmune issues as well, optimizing the gut is a very important thing to take into account. If anybody has any questions about hormones or neurotransmitters, let me know, but I don't want to get too far in the weeds with that right now. Other things to consider when we think of red flag indicators, things of that nature, a lot of unexplained weight gain would be a red flag indicator. Blood sugar dysregulation, high blood sugar levels, low blood sugar levels, higher cholesterol levels would be a factor. Really fascinating. Again, this is very medical here, so college professors aren't going to necessarily diagnose this, but maybe you're a nursing program or you're a med school. You would obviously have way more education about these topics than I would. Health inequities is a variable that can adversely impact the gut. Unfortunately, some students deal with a high degree of health disparities and health inequities. Technically, the person who brought up the question about COVID-19, look at the research on COVID-19 and the health disparities associated with that. When we think of health disparities, racism, marginalization, oppression, poverty, homelessness, neighborhood disadvantage, even oral health disparities are noted in this literature. Any one of those variables has been linked with more gut health issues. Personally, individually, these are some of the individual characteristics that could contribute to more gut health issues. So, somebody is just a highly anxious person. You just feel like you're walking on eggshells with that person. They have a high degree of anxiety sensitivity. That can absolutely increase gut health issues. Take a look at this topic just in case you've never heard of this alexithymia. If you Google my name and type in alexithymia, I've done lots of podcasts and articles on this topic. It is a variable you'd want to take into account. That word refers to emotional blindness. This is when somebody has a hard time naming, labeling, and making sense of emotions. It can look a lot like empathy deficits, perspective taking deficits. This is very common among trauma survivors, people dealing with burnout. Alexithymia has been linked with all kinds of different things. Really fascinating topic. Back to irritable bowel syndrome, irritable bowel disease. Avoidant coping strategies is another red flag indicator. If somebody has a really hard time coping with conflict, they procrastinate. They just have a very difficult time facing challenges head on and they run from them. Avoidant coping strategies could be another amplifier for some of these issues. So, alexithymia has also been linked with more irritable bowel syndrome. Interestingly, from a college standpoint, if you Google alexithymia and put in poor academic achievement, you'll find studies that look at this within that context. Medically speaking, alexithymia has been shown to be higher among people with chronic allergies, asthma, certain kinds of cancer, hypertension, again, the gut issues, and diabetes, just to name a few. If you have any questions on alexithymia, let me know. I might put together a training on this topic in the future. I do believe it's an underappreciated topic within the world of academia as well. So maladaptive thinking, this could be rumination, all or nothing thinking, catastrophizing, jumping to the worst case scenario. If you have a student that always jumps to the worst case scenario, that's a maladaptive thinking pattern. If a student has a tendency to have these thinking patterns, that has been linked with more gut health issues. High levels of fear, worry, high levels of anxiety, social anxiety, panic attacks have all been linked with more gut health issues. So if you notice a student or just anyone in your life, a very high degree of fear, they just seem very uneasy, more times than not, that could be an indication that maybe their gut is not working at optimal levels. If you want to help people manage fear, you're probably going to help them also optimize gut health performance. So, rumination, problematic thinking patterns, racing thoughts, getting stuck on something over and over and over again, can't let it out of your mind. There's depressive rumination. This might be someone that ruminates on really depressing thoughts, which amplifies their depression. You can have anger rumination. This would be somebody that can't let anger go out of their mind. That could be an amplifier for rage control issues in some cases. We have any forensic or criminal justice professionals here? Rumination could be a driver for domestic violence, child abuse, amongst a whole host of other kinds of things. Sleep is number one to health, in my opinion. Poor sleep is a threat to all kinds of things. I did a training for Hawks Learning previously on sleep disorders among college students, and sleep disturbances make academic performance worse. Sleep makes the gut worse. The gut makes sleep worse. It goes hand in hand. Circadian rhythms, why do I point this out? Because there's a pretty good chance that a lot of college students deal with circadian rhythm misalignment. If you work a shift job, you deal with jet lag, you're up all night cramming for finals, you work an overnight shift, and then the next morning you go to classes, that can throw off our circadian rhythms. That's our natural sleep wake cycle. Most people are meant to sleep at night and be up during the day. People that are up all night on shift work, circadian rhythms likely are off on some level. Why do you want to care about circadian rhythms? Take a look at this. This could be a whole nother training in and of itself, but research points to the fact that circadian rhythm misalignment may be more common among people with alcohol problems, mood disorders, depression, chronic pain. It could even be a factor in some cases of neurodegeneration. Metabolic dysregulation diseases, so metabolic dysfunction, cardiovascular disease risk factors, type 2 diabetes, obesity, cholesterol issues, things like that. HPA axis, again, that's our hormone regulator, all kinds of things. What I don't have on here, I give a lot of talks on criminal justice forensic topics. There's a couple studies that point to the fact that circadian rhythm misalignment could be a variable to take into account when trying to understand violent behavior in some cases as well. Smoking cigarettes has been linked with more gut health issues. So I'm not telling people what to do, but I think it's pretty safe to say smoking is not good for a person. Secondhand smoke is not good. Helping people quit smoking will likely help improve their gut. A lot of college students live a sedentary lifestyle, so physical inactivity has been linked with more gut health issues. We'll come back to this in the intervention section in a minute. Other variables to consider, again, I think we've covered this pretty well, but we know from the research literature, a higher percentage of college students deal with higher levels of stress. And a lot of times they don't eat the most healthy kinds of foods. In conjunction, these two variables in and of themselves have been linked with more gut-brain health dysfunction. Visually showing you here how this links to poor dietary behaviors in college students. Take a look at this. All you can eat meals on college campuses play a role in this. Snacking on foods late into the evening, typically foods that aren't that good. Maybe it's vending machine foods. High level of junk food, fast food. Maybe it's some unusual dieting patterns. Maybe it's a undiagnosed eating disorder. College students are more likely to drink sugar sweetened beverages, eat fried foods, and consume salty snacks. All of these things have been linked with more unhealthy gut functioning. Just the overconsumption of sugar has been linked with more gut dysbiosis. So, another just concrete variable to take into account. How much sugar are you consuming? I do a lot of work in this area too. It's a really fascinating topic. Another, I think, great class to offer your students is just a 101 class on the harmful effects of excessive sugar consumption. You will find studies too that talk about the overconsumption of sugar may actually negatively impact academic performance. Aspartame, I'm sure most of us know what this is. If you consume diet sodas, you're probably well aware of aspartame. Aspartame, not good for the gut. I'm putting together a training on aspartame for a different group right now, and aspartame consumption, really the overconsumption of this, could play a role in these variables here. Aspartame is in so many products. Some studies say it might be in over 6,000 products. So if you're consuming soft drinks, you're consuming lots of aspartame, but aspartame's in all kinds of different things. Just another variable to consider. So remember, we spoke about breakfast eating before. College students might be more likely to skip meals, and meal skipping has been associated with all kinds of problematic behaviors. So if that student's continually skipping meals, that could be another variable to consider in this equation. I would encourage you to take a look at the training I did for Hawks Learning on food insecurity, but food insecurity has been linked with more gut health issues. And unfortunately, an elevated number of college students would fall under this umbrella of being food insecure. Now, this is related to children, this study, but this absolutely will relate to adults as well. I just wanted to show you here the different variables that could impact school academic performance. Again, gut health issues, lack of exercise, obesity, meal skipping. It's a complex issue, lots of moving parts. And if your student is engaging in these kinds of behaviors, these would be classified as health compromising behaviors. And most of these, if not all of these, have also been linked with more gut health issues. And if you want a copy of my slides, just shoot me an email. I'll send you my slides. And when we talk about this too, remember the gut is the hub of immunity. If the gut is not working, that can weaken our immune system. These are other things that can weaken our immune system. So if you want to enhance immune system functioning, be aware of these variables. This last section, and then I'll open it up for questions, and then I'll stick around as long as we need. If I had it my way, every college program in the country that offers degrees in psychology and related topics would offer a class or a certificate in this. This is an emerging field of study that basically is gut health psychology. It's taking psychology and what I talked about before and putting it under one umbrella. And it's an emerging field of study that can help treatment providers, counselors, therapists, social workers treat chronic digestive health issues through a behavioral health lens. These are some of the interventions that are talked about in this literature. Some of these you might be familiar with, some of these you might not have ever heard of. But if you help students reduce their stress, you teach them about getting better rest, offering classes on this, maybe offer a cooking class, nutrition class. These are all interventions that can help that student's gut improve. Helping people have better flexibility in their thinking, less rumination, more going with the flow. Teaching people some of these things here have also been linked with improving gut health. Patient education, faculty education, student education. If we can start educating our staff, our colleagues, our students about these topics, through trainings, in-service workshops, maybe full-blown classes or certificates, it will likely lead to improved outcomes. Lifestyle changes, maybe some of you have heard of lifestyle medicine. Looking at that literature can be helpful, helping people get better sleep, make better healthy decisions, get their stress down, have more balance in their life, taking breaks. These are things to consider in this discussion today as well. Looking at this through a mental health lens, I believe next month I'll be doing a training for Hawks on the impact or college students with depression. I'm going to get a lot deeper in the weeds on these topics, but these are some potential interventions if you are working with students with mental health problems, particularly if you are a faculty member whose role is to provide counseling or therapy to students. Educating students again about irritable bowel syndrome, addressing this can play a huge role in improving student outcomes. Some of you who are in the counseling psychology field will have a great appreciation for this slide, but cognitive behavioral therapy and approaches have been used to help combat some of these issues as well. Maybe your college program offers a yoga class. Yoga has been shown to help address digestive health issues. Maybe it's a mindfulness class. Maybe you're doing some mindfulness exercises, just teaching students about mindfulness meditation. Plenty of research shows too that mindfulness can be very helpful. Self-compassion is a great strategy to use. Basically, self-compassion is just being nicer to oneself, cutting yourself slack, letting things go. Self-compassion training can help address digestive health issues. Teaching people about self-management skills, self-monitoring, executive function, just being more mindful of taking a proactive stance in addressing your health issues. Gratitude, just very practical strategies to be aware of. People that have more gratitude, higher levels of optimism, more hopeful thinking, likely have better gut health functioning. So, meditation, mindfulness, again, another study that just talks about the use of this intervention. Maybe your college campus offers some nutrition classes. Maybe you're a therapist on campus and you know the student just has very poor dietary practices. Maybe they have an eating disorder. Referring that student to a nutritional counselor, that's supported in the literature. These are some practical strategies you'd want to be aware of too that are found in numerous studies. But if you want to promote healthy eating among college students, this is kind of what the research says in a nutshell. Exercise again, getting movement, offering exercise classes, yoga classes, a walking club, a walking group with the goal of reducing sedentary behaviors can absolutely improve health and well-being, including academic performance, and it can play a very vital role in helping people improve digestive health functioning. And as we get close to wrapping up too, when we talked about immune system functioning before, it relates to what we're talking about today. These are some things found in the literature that have been linked with improved immune system functioning, getting better sleep, eating healthier, exercising, maintaining a normal weight. Some studies say that pet ownership can be very helpful, being around positive people, engaging in gratitude, optimism, enjoying life, laughing with people. These are all things that have been linked with increased functioning of our immune health. And just basic things that I consider that are very helpful, that are common sense is again, it ties in nicely to what we talked about before. So I appreciate all of you listening to today's webinar. Again, I probably threw about 40 hours of content at you in about an hour. Here's my email address again. Shoot me an email if you want a copy of these slides, you want to talk about any of these topics, let me know. I'm more than happy to share some resources with you. So I'll stick around, open it up to thoughts, questions, concerns.
Yep, we have lots of those. So the research is clear about ASD and the gut biome. However, why is this information so difficult for the public to accept? Why is this information censored? And whose interest does this ignorance serve?
I'd love to talk with you more, whoever asked that. I'd like to know, like with the censoring part, it's out there, it's easy to find, but how widespread is it being used in treatment programs? I think a big part, this is just my opinion, a big part is treatment providers, counselors, autism specialists don't have training on this or don't know where to get training on this. And that's another reason why I think college programs would do quite well offering degrees or trainings in this, because I think there is such a need out there for people to develop an expertise in this area. And it's not just for autism. I think the general public doesn't have a lot of awareness. I'd love to hear from all of you. Have any of you ever had a training on this in the past, or is this the first time you've heard about these topics? So hopefully today it plants a seed that we need to have more awareness, more trainings, because it really is front line to improving overall health and wellness. And I do think it plays a vital role in helping students improve overall academic outcomes and performance as well.
Thank you. So someone said, sounds like you are saying a problem gut leads to mental health issues, but couldn't it be the other way around or even a third factor?
Oh, sure. Yeah, there's a million factors. And I get that question a lot. Is it the gut that contributes to the mental health, or is it the mental health that contributes to the gut issues? It's the bi-directional communication. So I think both are at play. But let's think about this. If you know someone that has a severe mental health issue, that's an indication that their gut is not working at optimal levels. You could have somebody that has no mental health challenges, but all of a sudden starts eating unhealthy, living a sedentary lifestyle. They're dealing with a lot of stress. And over time, their gut dysfunction puts them at greater risk for more mental health challenges. So it can kind of bowl both ways. But if you want to optimize health and well-being, optimize the gut. And if you are a treatment provider and you want to help people reduce mental health symptoms, optimizing the gut is a frontline intervention. I'm not saying it's going to cure mental health, but it can make things a lot better.
Thank you. And I'm totally going to butcher this name, but I'm going to try anyway. Can you talk a little bit about Bifidobacterium adolescentis and vaccines?
I'm not going down that road. I'm so sorry. I hate to do that. That is too controversial. I would recommend talking to the healthcare provider, but if we're talking about like probiotics, prebiotics, things like that, numerous studies out there. Talk to your healthcare provider. For some people too, you need to be aware of the topic of biochemical individuality, because every person is wired differently. And there are a number of different tests out there that people can get to get like a gut health profile, finding out how their gut is functioning. The only downside with that is, and I could be wrong, I don't know every state, a lot of times these tests are provided through functional medicine and they're not covered by insurance and they can be quite expensive. So for a lot of college students, they might not benefit from this because they won't have access to it, because insurance doesn't pay for a lot of these gut health tests yet. Hopefully that changes at some point.
Thank you. Might the link between fast food, unhealthy food, and gut health be found through the glyphosate mechanism that is in the US, where most wheat is loaded with glyphosate, whereas in other countries in Europe, such as Europe, this chemical is banned?
Another variable to take into account, I have a story kind of on that line. I know somebody who has profound gut health issues, and they eat not too good in the United States. They went to Europe for a couple weeks on vacation. They ate the same way, but they did not experience the same level of gut health issues. So something to take into account there. Yes, what you said is a variable. But if you take that variable out and we just look at just ultra processed foods in general, numerous studies find that that way of eating leads to gut health issues, gut dysbiosis, inflammation, all kinds of problematic issues, including behavioral health challenges.
Thank you. How do you encourage students to make changes when they are resistant to changing their poor habits that are affecting their gut?
I think it starts by maybe we just, if appropriate, again, your every college program's different, but is there a way to offer a lecture on this, to offer an in-service, make it an extra credit assignment, get it part of a curriculum. Just educating students about this may turn on the light bulb for some students. Other things you could consider, motivational interviewing, lots of good training on that. There's a whole line of literature on nudging interventions. If you Google nudging interventions, that might be a very helpful thing to do. Journaling has been shown to be helpful, especially reflective journaling. Having support groups on this, having nutritionists come in and maybe do a cooking class. There's a lot of ways to get creative here, but first and foremost, educating students about these topics. Because when I was a college student, my undergrad, I knew nothing about this. I did not consider any of these variables. The more we can alert people about this, the more light bulbs will be turned on, and hopefully people will be more likely to make some lifestyle changes that can optimize their overall health and well-being.
Thank you. Do you have any resources for TBI and long COVID and gut-brain access?
I have numerous TBI resources. If you shoot me an email or you can Google my name and type in traumatic brain injury, you'll find some articles. Not specific to COVID, but I have lots of resources specific to traumatic brain injury within the context of mental health and the criminal justice system topics.
Thank you. And which bacteria should be in the gut and what's the right balance?
Too complicated that there are so many different factors with that to talk about. If you shoot me an email, I can send you some recommended articles. Every person is different. There's so many different strands of different kinds of bacterias. It's way too complicated. I'm not trying to pass the buck here. It's a we need multiple hours to weave through that. But just know when there's an imbalance in gut bacteria, that is gut dysbiosis. There are good bacteria, there's bad bacteria. The over production of bad bacteria can lead to leaky gut, which is basically intestinal permeability, which is more inflammation in the gut lining. And over time, that bad bacteria can leak out into other parts of the body, which then can contribute to all kinds of problematic health outcomes.
Thank you. Is DHA helpful for the gut?
I'm good at I can't give nutritional advice or supplemental advice. There's some wonderful research on DHEA. Talk to a nutritionist, functional medicine provider, or your healthcare provider, but there's a lot of good research on that. I can't comment just because of medical liability, things like that, on specific supplementation, things like that.
Fair enough. And then one last question. How do we help students increase vegetable, fruit, and healthy foods when they are short on time and have restricted finances? They are studying, working, and have families to look after.
I've thought about that a lot. And the literature says use nudging interventions. So starting to offer healthier food choices on campus. I've I consult on a lot of cases where the clients have lower socioeconomic status and they say it's just so expensive to eat healthy, which I do agree. It's probably more expensive to eat healthy. But looking at that student's dietary patterns, looking at the students' planning abilities, their organizational abilities is recommended. It's recommended maybe they work with a nutritionist. or you offer a cooking class and teaching alternative ways to do this and to really look at their budget. Is that student spending tons of money on sugar sweetened beverages? Are they spending tons of money on fast food? Are they spending tons of money on their cell phone? Where maybe they haven't connected the dots with a good budgeting class. Could they reallocate at least just some of those funds to a pool of money where they could buy healthier foods? Because a lot of times people don't put fruits and vegetables at the top of their list when they think about their budget, especially younger people. Educating them about it, providing them practical resources, and also getting buy-in from them. Slight nudges, start small, and then teaching them ways how to make things that might be really easy to do, where they could freeze them or just have alternative ways to save them time and have people come in that maybe have made lifestyle changes. I am a classic example of a college student who ate fast food every day, didn't take care of myself. Several years ago, my wife and I changed our lifestyle and our diet, and that's a big reason why I'm passionate about these topics too. Having someone come in who is living the way they are living right now and talking about the lifestyle changes they made might be helpful, turns on the light bulb a little bit. Who knows what seed you're planting? Maybe you won't see any benefits today or tomorrow, but we don't know what a year from now holds. So planting those seeds now may pay off later.
Thank you so much.
You're welcome. Great questions, everyone. I appreciate all of you. And yeah, you have my email and you want my slides, I'm more than happy to share them with you. And
All right, great. Give me one quick second. That looks like all the time we have for today. Thank you, Jared, and thank you all for attending today. I hope everyone has a great rest of your day. Thank you so much.
thanks, everyone.